Hi, good evening everybody. Tonight's live stream is all about Osgood-Schlatters, which is a painful condition in children where they get knee pain. The topics I'm going to cover tonight is what happens to children when they grow, how this can cause injuries like Osgood-Schlatters. Then I'll run you through some of the flexibility tests I do with kids in my clinic. And finally, I'll also discuss my treatment approach and how you can get kids to recover from that and get back to sport really quickly. Welcome, my name is Maryke and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. Okay, so what happens to kids when they grow? Essentially, their bones grow faster than their muscles and their nervous system, or than the nervous system and the muscles can lengthen. So what you get is that when they go through a growth spurt, they become extremely tight in their muscles, but also neurally. So maybe it's worth explaining how the nervous system works first. So our nervous system is pretty much from the brain, spinal cord connected into nerves that goes into your toes and into your fingers. So if the bones grow, you can see how all of that's going to be stretched and they're not going to be free to slide. Also, the muscles, their muscle fibers have to adapt to the new length. And there's no research to back this up, but my feeling is that sometimes the brain actually keeps the muscles slightly tense to protect the nervous system because it knows it's not ready to slide yet, it's not long enough. So the other important thing about kids to know is that whereas adults, we've got our muscles turns into tendon, attaches into bone. So for instance, if you think of my bicep muscle, this is the muscle belly, and I'll have a tendon there running from the biceps belly onto my elbow. And the same thing here, I'll have a tendon running from the biceps and attaching into the shoulder. And it attaches directly into the bone. But for kids, because they're still growing, theirs attaches onto a piece of cartilage or cartilage little plate on the bone. So instead of being tendon onto bone, it's tendon onto cartilage onto bone. So you can see that it's a softer, more vulnerable place where that tendon attaches. And that is how they are vulnerable to injuries like Osgood-Schlatters. Now, Osgood-Schlatters is basically pain that they develop if you feel under your knee on your shin bone, you've got a knobbly bit there. That's your tibial tuberosity, and that's where the tendon from your patellar tendon from your quadricep muscle attaches. Now, with Osgood-Schlatters, the cartilage bit that the kids have there becomes inflamed and sore because there's too much tugging on that piece of cartilage, and you can get that in all areas of the bodies. So for kids who does a lot of pitching and baseball, they can get it in the elbow. And they've actually set really strict standards for how many times a kid can throw during practice and things to stop that from developing. Other areas where they get it is back of the heel. So where adults get Achilles tendinosis, they get where it, instead of the tendon being the issue, they get it where it attaches into the heel again. Another one is, let me think, where else do I see them often? To be honest, those are the most two common ones I see in the UK. You can also get it on the side of the foot. But the most two common places where kids get issues with their growth plates or where the tendons attach into the cartilage bit is at the knee and back of the heel. So why does it develop? Why does it happen? So it's usually when kids go through a growth spurt, so everything becomes really tight, and then they do sports. So you can imagine when you're doing sport, it's natural for the muscles and the tendons to tug on the bone, and that's not an issue, except if things are over tight. So what the research has shown is that it is kids who does a lot of sport. So thinking off the top of my head, I've just seen a kid who does who's got it in the knee, Osgood-Schlatters, and she does sport on 6 days of the week, and it's both netball for school as well as for county level. So there's not really a lot of time for them to recover. And this leads into how we normally treat Osgood-Schlatters as well. You can see that it's a problem with flexibility, but it's also a problem with things are inflamed and we need to give it time to recover. So the treatment approach has two parts to it. One is to decrease the load on the inflamed area so that it can get enough time to recover. And the second part is to improve the flexibility. So which one do we discuss? I think what we're going to discuss first is load. Whenever you've got an injury, you have to pull back a little bit from your sport to give it time to recover. Now, you guys know by now that I'm a big proponent of relative rest. And the thing with Osgood-Schlatters is that depending on how bad it is, kids don't necessarily have to stop all their sport. So it's usually running sports, jumping sports, anything where sprinting is involved. Football is a big culprit for Osgood-Schlatters that causes it. So in the case of the girl who played netball, what I got her to do was decide which of those matches and which of the training sessions in the week are the most important ones. So that they just choose 1 or 2 training sessions and maybe not go full out on that while they recover. If their knees are really, really painful to the point where they hobble for the whole day after they've played sport, and even the next morning when they wake up and walk around it's still painful, they may have to stop all running and jumping type sports. In that case, they would have to probably cycle or swim for a little bit. It usually doesn't take more than 2 weeks for it to calm down to a point where they can start a little bit of sport again. If they're only getting pain after half an hour of doing sport and it stops or decreases within about an hour or so after they stop sport, I usually find those kids can still continue with sport just at a reduced level while they recover. So you've got to really, the first step would be to look at the whole volume of sport the kid does, especially sports that involves running and jumping. Determine how bad the pain is, how bad it's flared up, whether they need to cut back a little bit or whether they need to fully stop until it's calmed down a bit more. And then work out alternative things for them. Kids get just as depressed as adults when they can't do their sport. So it's really important to give them stuff to keep themselves busy with. And that can be swimming or cycling, something else that's a little bit more fun. Okay, so you've reduced the load. Then the second bit is to improve the flexibility. Now, treatments like massage and dry needling, things like that is definitely useful to help improve flexibility. But the problem is if the kid doesn't do something every day while he doesn't see you, that flexibility won't stay there. And also you need to educate him because he's going to continue growing. So you've got to give him the tools that him and his parents can use to stop this condition from coming back. So what I do with the stretching normally is you have to decide, or you have to determine how flared up the child's knee is. If that tendon is really painful and sore, stretching it is not going to help. It's actually going to make it worse. So you've got to make sure that when you give them stretches that it doesn't cause pain in the knee and it doesn't cause pain afterwards. And if it does, you've got to adapt your stretch. Then you've got to find something else to do. And I'll run you through all of that in a minute. The other important thing to remember is that if they're having issues with their knees from Osgood-Schlatters because they're overly tight in their quads, chances are they're also tight in their hamstrings and their calves. So it's always useful to just check all of those areas and make sure they're flexible everywhere, because otherwise they'll just end up with another strain injury in a different body part. Good. So let's move on to how I test flexibility for the different muscle groups. Just to recap up until now, Osgood-Schlatters is a traction injury where there's too much pulling on the tendon where it attaches into the cartilage of the bone of the child. It's usually brought on when they have a growth spurt and everything becomes really tight. And you fix it through managing their load, so decreasing the load to the point where that can recover and improving their flexibility. On that point, people used to talk about Osgood-Schlatters as a self-limiting condition, meaning that you can't do lasting damage. Well, we know these days that that is absolute rubbish. Children they're not unbreakable. So I sometimes just I get exasperated, I think the word is, how people think that they can just pile more and more and more sport and activities and things on kids and they should just cope. Their bodies also need time to recover. So what happens is, if you neglect this type of condition and they continue with high level sport, because some kids are really determined, they can work through the pain, you can actually get that cartilage plate where the tendon attaches to the bone can pull away. And I have seen adults with really disfiguration in the knee, causing them loads of trouble in later life, stopping them from running and doing the sports they want. And sometimes people even need surgery as adults to correct things that they can get on with life. So although in most cases Osgood-Schlatter is really not a problem, it's not good to ignore it to the point where it actually causes damage later in life then. Okay, so that's enough scaremongering for one night. Let me get on to what you can do to test flexibility. I'll show you the hamstring one first because it's the easiest one. Let me just adjust these things and try not to break anything. Okay, so if you can roughly see how I bend there, I think actually I'm going to place this one on the floor so you can see my feet. So when we're testing for hamstring flexibility, you keep the knees straight and you get them to just slide down the front of the legs with legs straight. Now, often they'll get to there and the parents will say, oh, no, the dad is really stiff. He can't touch his feet either. That's why the kid is so stiff. Now, if this is a child of 12 years old, that is nonsense, I'm afraid. He may be on the stiffer side of the spectrum, but only being able to reach just below his knees is not flexible enough. I wouldn't expect all children to be able to place their hands flat on the floor. That's not necessary either, but I would want them to at least get to their ankles. So to just show you that again, you're going to keep your knees straight and they slide down and see how low they get. And I also like to use that as an objective measure for them to help motivate them so that they can see how much lower they get as they do the stretches for that. Now the calf muscles is a slightly more difficult one. I've got a lovely little incline gadget that I make them stand on, which gives you degrees and dorsiflexion for where they can stand. But if you don't have a gadget like that, I guess the easiest way to check if they've got tight calves is to try and get them to do a squat. So what you'll see is if you get them to squat to 90 degrees, they should be able to get there without adjusting their feet. So let me see if I can get myself in there fully. I'm going to bring it down a little bit more. So I'm going to show you from the front. If I squat down to 90 degrees, you can see how my feet, my arches stays lovely and normal, and my heel stays on the floor. Now, if their calves are tight, they'll get to there and they'll want to fall over when they try to go lower, or you'll see that they do something like that, or they would want to put their feet right out there. So to have normal calf or dorsiflexion range, they should be able to squat down to 90 degrees without changing that shape. The only exception to that, I would say, is with people with really high arches. In that case, the foot arch can actually stop the ankle from getting the full dorsiflexion. But if you don't have any other way of testing it, that can be a quick guide for you to see how tight they are. Then the important one for Osgood-Schlatter is actually finding a way to see how tight the quad muscle is. Now I've been trying to figure out how I'm going to do this, and I've decided that the easiest way may be if I use my bed for this one. So now let me just see. So it's the Thomas test. I'm pretty sure that any physios or clinicians in the group may have heard of it. I would say it will probably work better if you've got a table that the kid can lie on. So if you've got quite a sturdy dining room table, that may work better. Is this going to work here? Let me see. We'll get there in the end. Up. Okay, let me just see. Not really going to work, is it? I may have to, you know what? You're going to have to check in the blog post to get a proper idea of this, because I've given you pictures in there. But let's see what I can do here. Okay, so that will kind of work. So what you get them to do is they're right on the edge of, it should be higher. The feet shouldn't be able to touch the floor. So probably a table would be better. And they've got to bring their one leg straight into their chest and then be able to drop the other one down. And then imagine I'm on a slightly higher bench that I can, whoops, not break my camera, up, that I can get my other leg underneath me. Okay, that would be a nice full range stretch. If they're unable to get the knee bent past that point, then they're really tight there. Or if this is sticking up, this is usually what I see in clinic, is they're not able to even drop this one to neutral. It stays in there. That means they've got a really tight hip flexor. But yes, so the combination is that they should drop to that level and be able to bring it underneath them. But definitely a higher thing than the bed. That test will definitely make more sense if you read the blog post, because I've got pictures in there that I think demonstrates it a little bit better. But if you wanted to Google it, it's the modified Thomas test that you can use to test the quad length. If you're just a parent and you're watching this, you know what? You don't have to get that technical. What you could do is just see if they're standing upright. Let me see if I can get myself in focus there. Can they grab hold of there and get their leg back and have it there? If they have to get the knee forwards to bring their heel in, then they are tight. If they can get it back there, but they can't get this closer to them bottoms, then they're tight. So that is pretty much where they want to be. Now, I'm not going to demonstrate all the stretches for you today, because I've made a whole video today actually of all the different versions of the stretches that you can do for Osgood-Schlatters. The big thing is you want to stretch the hip flexors as well as the quads, because your rec fem, which is part of the quadricep muscle, comes over both bits. So to give you a quick example of if the knee is really, really painful and you can't do stretches for that, you'd work on stretches that you first get a stretch over this bit only, and then you'll go into the full-on stretches. But yes, I'll place a link in the comments to a video that I've done today that's specially just about all the various variations of stretches that you can do for that. So treatment approach for Osgood-Schlatters. First of all, determine, do they need to fully rest? Do they need to just kind of choose the most important bits in their week that they can't get away from? Or can they just maybe play half a match? Is it possible to do things like that? Then second is work on the flexibility, but it has to be pain-free. If it can't be done pain-free, they've got to stay off sport until their knees have calmed down enough that they can do the flexibility. And then the last important thing with regards to the treatment is, once their knees are calmed down, they shouldn't just rush into all sport again. You need to slowly add the sessions of sport in. So usually what I get them to do is do about 3 times a week so that they've got enough space in between, and we see how they react. So it's not full out sessions that they're doing. They doing half the sessions. I speak with the teacher, or I send an email and I ask, can he do light sprinting? Can he be excused from, say, heavy jumping things? Just analyze what type of sport the kid does and what things would be useful to just hold back. So remember always, jumping is definitely a more load than sprinting, and sprinting is more load than just jogging. So you first want to get them back to jogging, then to sprinting, and then to jumping. So there are loads of different things that you can do in the rehab. Now, one of the questions that I had in the group as well was about whether I do strengthening versus stretching. Osgood-Schlatters, I usually don't find that it's a strength issue. Usually by the time that we've sorted out the flexibility, their balance and everything have returned as well. But you've got to remember, as soon as a kid grows, their whole proprioception, so their position sense, everything is off. So you'll often find if you test their balance, they're all over the show. So to keep them busy while they're recovering, it's good to include things like balance exercises and stuff as well. But I wouldn't necessarily bother with strengthening exercises for the quads unless once they're pain-free, I test them and I find that that's an issue. But the main thing that's driving the pain and the irritation from Osgood-Schlatters is the extra pulling on that tendon. So it's all about the rest and the increasing of flexibility. Okay, so it feels as if I've waffled a bit. Let me know if you've got any questions, but what I'll do is I will share the blog post and I will put a link to the stretching exercises that I use in clinic. And then, yeah, I need you to just let me know if you've got any questions. Take care. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.